Medical Dispatch is a digital broadcasting program designed to give you general medical information on current events, and is not medical advice. Please consult your personal medical team for any medical advice. Medical Dispatch is for informational use only. Medical Dispatch can be heard only on the USAEBN Digital Broadcasting Network. www.usaebn.org.
Hand, foot and mouth disease. A mild, contagious viral infection common in young children is characterized by sores in the mouth and a rash on the hands and feet. Hand, foot and mouth disease is most commonly caused by a Coxsackie virus. There's no specific treatment for hand, foot and mouth disease. Frequent hand washing and avoiding close contact with people who are infected with hand, foot and mouth disease may help reduce your child's risk of infection. Hand, foot, and mouth disease, or HFMD, is a contagious illness caused by different viruses. It is common in infants and children younger than 5 years old, because they do not yet have immunity, also known as protection, to the viruses that cause HFMD. However, older children and adults can also get HFMD. In the United States, it is more common for people to get HFMD during spring, summer, and fall. HFMD is usually not serious, and nearly all people recover in 7 to 10 days without medical treatment. Rarely, an infected person can develop viral meningitis and may need to be hospitalized for a few days. Other even more rare complications can include polio-like paralysis, or encephalitis, otherwise known as brain inflammation, which can be fatal. Symptoms. Hand, foot and mouth disease may cause all of the following signs and symptoms or just some of them. They include fever, sore throat, feeling of being unwell, also known as malaise, painful, red, blister-like lesions on the tongue, gums, and inside of the cheeks, a red rash, without itching but sometimes with blistering, on the palms, sole of the feet and sometimes the buttocks, irritability in infants and toddlers, loss of appetite. The usual period from initial infection to the onset of signs and symptoms, incubation period, is 3 to 6 days. A fever is often the first sign of hand, foot and mouth disease, followed by a sore throat and sometimes a poor appetite and malaise. 1 or 2 days after the fever begins, painful sores may develop in the front of the mouth, tongue, or throat. A rash on the hands and feet and possibly on the buttocks can follow within 1 or 2 days. Sores that develop in the back of the mouth and throat may suggest that your child is infected with a related viral illness called herpangina. Other distinguishing features of herpangina include a sudden high fever and in some instances, seizure. Sores that develop on the hands, feet, or other parts of the body are very rare. The child might get a rash on the palms of his hands or the soles of his feet a day or 2 after the first symptoms appear. This rash may turn into blisters. Flat spots or sores may pop up on the knees, elbows, or buttocks. He could have all of these symptoms, or only 1 or 2. Mouth sores can make it hurt to swallow, so be sure your child gets enough water and calories. These symptoms usually appear in stages, not all at once. Not everyone will have all of these symptoms. Some people may show no symptoms at all, but they can still pass the virus to others. When to seek medical advice. Hand, foot and mouth disease is usually a minor illness causing only a few days of fever and relatively mild signs and symptoms. Contact your doctor if mouth sores or a sore throat keep your child from drinking fluids. And contact your doctor if after a few days, your child's signs and symptoms worsen. Causes. The most common cause of hand, foot and mouth disease is infection with the Coxsackie virus A16. The Coxsackie virus belongs to a group of viruses called non-polio enteroviruses. Other types of enteroviruses, enterovirus 71, sometimes cause hand, foot and mouth disease. Oral ingestion is the main source of Coxsackie virus infection and hand, foot and mouth disease. The illness spreads by person-to-person contact with an infected person's nasal secretions or throat discharge, saliva, fluid from blisters, stool, respiratory droplets sprayed into the air after a cough or sneeze. Common in child care setting. Hand, foot and mouth disease is most common in children in child care settings because of frequent diaper changes and potty training, and because little children often put their hands in their mouths. Your child can catch hand, foot and mouth through contact with someone who has it, or from something that's been in contact with the virus, like a toy, tabletop, or doorknob. Although your child is most contagious with hand, foot and mouth disease during the first week of the illness, the virus can remain in his or her body for weeks after the signs and symptoms are gone. That means your child still can infect others. Some people, particularly adults, can pass the virus without showing any signs or symptoms of the disease. Outbreaks of the disease are more common in summer and autumn in the United States and other temperate climates. In tropical climates, outbreaks occur year-round. Different from foot and mouth disease. Hand, foot and mouth disease isn't related to foot and mouth disease, sometimes called hoof and mouth disease, which is an infectious viral disease found in farm animals. You can't contract hand, foot and mouth disease from pets or other animals, and you can't transmit it to them. Risk factors. Hand, foot and mouth disease primarily affects children younger than age 10, often those under 5. Children in child care centers are especially susceptible to outbreaks of hand, foot and mouth disease because the infection spreads by person-to-person contact, and young children are the most susceptible. Children usually develop immunity to hand, foot and mouth disease as they get older by building antibodies after exposure to the virus that causes the disease. However, it's possible for adolescents and adults to get the disease. Complications. The most common complication of hand, foot and mouth disease is dehydration. The illness can cause sores in the mouth and throat, making swallowing painful and difficult. Watch closely to make sure your child frequently sips fluid during the course of the illness. If dehydration is severe, intravenous or IV fluids may be necessary. Hand, foot and mouth disease is usually a minor illness causing only a few days of fever and relatively mild signs and symptoms. A rare and sometimes serious form of the Coxsackie virus can involve the brain and cause other complications. Viral meningitis. This is a rare infection and inflammation of the membranes, meninges, and cerebrospinal fluid surrounding the brain and spinal cord. Encephalitis. This severe and potentially life-threatening disease involves brain inflammation caused by a virus. Encephalitis is rare. Prevention. Certain precautions can help to reduce the risk of infection with hand, foot and mouth disease. Wash hands carefully. Be sure to wash your hands frequently and thoroughly, especially after using the toilet or changing a diaper and before preparing food and eating. When soap and water aren't available, use hand wipes or gels treated with germ-killing alcohol. Disinfect common areas. Get in the habit of cleaning high-traffic areas and surfaces first with soap and water, then with a diluted solution of chlorine, bleach and water. Child care centers should follow a strict schedule of cleaning and disinfecting all common areas, including shared items such as toys, as the virus can live on these objects for days. Clean your baby's pacifiers often. Teach good hygiene. Show your children how to practice good hygiene and how to keep themselves clean. Explain to them why it's best not to put their fingers, hands, or any other objects in their mouths. Isolate contagious people. Because hand, foot and mouth disease is highly contagious, people with the illness should limit their exposure to others while they have active signs and symptoms. Keep children with hand, foot and mouth disease out of child care or school until fever is gone and mouth sores have healed. If you have the illness, stay home from work. Your child is most contagious in the first 7 days. But the virus can stay in their body for days or weeks after symptoms go away, and it could spread through their spit or feces. The best way to prevent that is to wash hands thoroughly. That applies to you too, after you change a diaper or wipe a runny nose. Your child should be fever and symptom-free before they go back to school or daycare. Check with your doctor if you aren't sure whether they are still contagious. Ask their school or daycare about their policy on when a child can return after illness. Hand, foot and mouth disease is not the same as foot and mouth disease, which comes from a different virus and only affects animals. Diagnosis. Your doctor will likely be able to distinguish hand, foot and mouth disease from other types of viral infections by evaluating the age of the affected person, the pattern of signs and symptoms, the appearance of the rash or sores. Your doctor may take a throat swab or stool specimen and send it to the laboratory to determine which virus caused the illness. Treatment. There's no specific treatment for hand, foot and mouth disease. Signs and symptoms of hand, foot and mouth disease usually clear up in 7 to 10 days. A topical oral anesthetic may help relieve the pain of mouth sores. Over-the-counter pain medications other than aspirin, such as Tylenol or Advil, may help relieve general discomfort. Hand, foot and mouth disease should go away on its own after 7 to 10 days. There is no treatment for the illness and no vaccine. You can ease your child's symptoms with over-the-counter pain relievers like Advil or Tylenol or numbing mouth sprays. Don't use aspirin for pain; it can cause serious illness in children. Cold treats, like popsicles, yogurt, or smoothies, help soothe the sore throat. Anti-itch lotion, like calamine, can help against rashes. Lifestyle and home remedies. Certain foods and beverages may irritate blisters on the tongue or in the mouth or throat. Try these tips to help make blister soreness less bothersome and eating and drinking more tolerable. Suck on ice pops or ice chips. Eat ice cream or sherbet. Drink cold beverages, such as milk or ice water. Avoid acidic foods and beverages, such as citrus fruits, fruit drinks, and soda. Avoid salty or spicy foods. Eat soft foods that don't require much chewing. Rinse your mouth with warm water after meals. If your child is able to rinse without swallowing, swishing with warm salt water may be soothing. Have your child do this several times a day or as often as needed to help reduce the pain and inflammation of mouth and throat sores caused by hand, foot, and mouth disease. The symptoms of hand, foot, and mouth disease can make children very uncomfortable and irritable. The rashes and blisters can be very painful for the little ones. Try these home remedies to soothe the symptoms and make your child as comfortable as possible. For other home remedies that you might want to try, check out usaebn.org article on hand, foot, and mouth disease, in the Medical Dispatch Lighthouse Briefing Room. Seeking medical advice. If you take your child to a doctor, make the most of your time by writing down information the doctor will need before you go, including any signs and symptoms your child is experiencing, how long your child has been having signs and symptoms, whether your child has been in childcare or other environments where the disease might be spread, any questions you have. Some questions you might want to ask your doctor include: what's the likely cause of the symptoms? Are there other possible causes? Will my child need to undergo any tests? What's the best treatment approach? Is there a need to take medicine? What can I do at home to make my child more comfortable? What to expect from your doctor? Some questions the doctor may ask include: when did symptoms first begin? How severe are the symptoms? Has your child recently been exposed to anyone who was sick? Have you heard of any illnesses at your child's school or childcare? Does anything seem to improve the symptoms? Does anything appear to worsen the symptoms? What you can do in the meantime. To help lessen discomfort, doctors often recommend getting rest, drinking fluids. Milk-based fluids may be easier to tolerate than acidic liquids, such as juice or soda. Using mouthwash or oral spray to numb pain.